Hello, Santa Fe. Happy Friday afternoon. Mayor Alan Webber here in the mayor's office on a beautiful Friday afternoon in Santa Fe as we head into Memorial Day weekend. Everybody, please stay safe, have some family time, reflect on not just COVID and safety, but all the men and women who keep us safe and have always done so through their service, whether in the military or in frontline responders, essential workers, people who have helped shepherd us safely through this COVID crisis. We're now beginning to emerge from it in Santa Fe County. As of the last count, 74% of us have had one vaccination. 63% of us are fully vaccinated. That's great. We got more work to do, and there are more vaccines out there. They are available. They're plentiful. You can make an appointment or in some cases just do a walk-in and get vaccinated. And we'll talk more about other matters, but let's start with our regular Friday guest, Dr. Wendy Johnson, who is pulled over by the side of the road so she can talk safely and hands-free. Dr. Johnson, nice to see you. Let's talk about where we are with the overall trending of dealing with COVID, and then some things we haven't talked about lately, like the encouragement to get tested if you have symptoms. Remind people, we haven't talked about symptoms for a while because we've been focusing on doing better, getting vaccinated, but we still have cases. And if you wonder if you might have one, what do you do to get tested, and remind us what those symptoms might be, because we haven't talked about that for literally months now. So over to you, Dr. Johnson.
Yeah, I think that's an excellent point. We've had, in our office, according to CDC guidelines, which we're following, we were screening all employees every day, but now we're just screening the people who aren't fully vaccinated, which is a very small, basically some of our new hires, it's almost nobody. Over 90% of our patient population is vaccinated now, or of our staff rather. But what's happening though is vaccinated people are getting a little complacent. I've had just among our staff, the standard is if you're having symptoms, stay home and get tested, or we refer our staff to get tested. So, if for the general public, if you're having symptoms of fever, cough, congestion, headache, we've also actually, another public health thing, we've had an outbreak of a real nasty gastroenteritis called Norovirus in town. So a lot of people are getting nausea, vomiting, diarrhea. It's an extremely contagious virus. It's contagious through touching surfaces. So we're all concerned about coronavirus and touching surfaces. That's not a problem, but norovirus can live on surfaces for a long time. And if you touch that surface and touch your mouth, you have a high percentage of getting it. So that's another virus that's going around that can be confused with coronavirus, but that one is really gastrointestinal, doesn't have the respiratory symptoms. So for sure, if you have those respiratory symptoms, and it's for sure if you have fever or loss of taste or smell, absolutely go get tested, even if you're vaccinated, because you can get it if you're vaccinated. Some people don't mount an immune response. Even if you're vaccinated, very small numbers of people have been hospitalized and even died of COVID having been fully vaccinated. It's very unlikely, but you don't want to be, the 1 in a million person. So get tested.
And as you mentioned, the other disease we're grappling with, hand sanitizer and masks can still be helpful.
Right.
We said during the early days of coronavirus, we said, don't touch your face, don't move potential germs or the spread of it into your facial area. That's a good rule in general. And so totally. Masks still work. If you want to be a good example, as the town opens up for more tourists, and we're seeing a lot of folks come to Santa Fe, which we're happy to see. It's a celebration of a return to some joy and fun in life, but we don't want to go into getting sick.
Right.
Vaccinations, 12 through 17-year-olds, right?
Yeah, I just want to make one other really important and interesting point. The last flu season where we weren't wearing masks before the pandemic, we had 38 million cases of flu. Last year during the pandemic, guess how many cases of flu were under 3,000 were reported to the CDC. Now we had more than that. They didn't do the estimate, but still we went from 38 million to, probably less than 100,000 for sure, maybe probably less than 10,000 cases of flu in the country, which is astonishing and amazing. The masks work, and whether or not coronavirus works for the surfaces, the hand sanitizer, not touching your face and mouth, just exactly what you said, it's going to help you stay healthy in general. But the vaccine,
talk about who can get vaccinated and where you can go. Do you need an appointment these days? Are there walk-in clinics? If I have not yet, let's say I'm not, it's not that I'm opposed to getting vaccinated. It hasn't been convenient, or I wish I could get away with the Johnson & Johnson one and done vaccine, because I can't schedule two separate appointments. What are the availabilities, and how young are we going now in Santa Fe to get people vaccinated?
So right now, Pfizer is the only vaccine that goes to 12. And there have been some reports of a myositis or myocarditis, some muscle inflammation in adolescents. And I've heard from even some of my friends that they're waiting to get their kids vaccinated until they know more about that, which I understand. But I just want to say they're investigating it. It's very rare still. Seems to be more in young boys, young men than women. And it's still, the number of cases are still far less than 1%, something like 0.01% or 0.02% of everybody. Something like, 3 or 4 people in 100,000 are getting this. And this side effect seems to be time limited as well. So it's not like, a lifelong disability or anything like that. So it's serious, and I'm not minimizing it, but it's important to keep it in perspective. Also, there are a growing number of colleges and schools that are requiring vaccination to return to school. I don't think Santa Fe Public Schools has had a determination about that yet, but lots of colleges in our area and in the country, and a lot of kids are going back to those colleges, and a lot of those colleges are requiring vaccination. So we'll probably have to vaccinate. If you are waiting on that, then I understand it's being investigated, but chances are you're going to have to get your kid vaccinated. Very soon, you're going to have another choice. Probably in early June, Moderna is going to get approved for the 12 to 16-year-olds, or 12 to 18 really, because they only went to 18 and over for Moderna. And then I don't know about Johnson & Johnson. I haven't heard anything about that. In terms of getting a vaccine, if you haven't gotten one, again, the easiest way is to go on the Department of Health website, put in your location, whether you're Santa Fe or Espanola or Albuquerque or wherever you might be, and all the places where you can go are going to come up in your area. And some of them are going to be walk-ins. If you can't go there, you can call, I think, Walmart. Any pharmacy is going to be able to direct you to a place. Here in town, Christus has some clinics they're doing directly. If you're a patient of La Familia, we have clinics we're doing directly. We're going to start probably in the next couple of weeks doing the 12 and older. And so there's a lot of places you can go to get vaccine. Talk to your primary care provider. They could, I'm sure, direct you to the right place as well.
And what do we know about variants these days? Why don't we just run around it's baseball season. Let's go around the bases. So
Sure.
we've talked about vaccines. We've talked about dealing with symptoms. We've talked about trying to keep down the growth of COVID exposures. Where are we with variants that might be in our future? I actually had somebody raise with me something I hadn't heard, which was, are we going to see an August spike? Has anybody got any word in the CDC or medical public health world that sometime this summer there might be another spike that we need to brace for?
So I'll deal with the spike first, and then the variants. The spike, there are 3 or 4 big public health institutions that do modeling based on everything we know, based on the variants, based on the contagiousness, based on the vaccination rates. And the last modeling that I saw from those organizations, which was a couple weeks ago now, actually predicted we might have a little spike right now. When we're not yet fully vaccinated, when the variants are starting to be more common, and when people are basically starting to gather more and maybe starting to be less careful. So not as bad a spike as certainly we had November and December, but a little minor spike late May, early June is what was predicted by all the models. So we'll see. We're seeing cases go down a little bit, but really we're hanging out kind of around 10 in Santa Fe every day. We're sort of plateauing. So we'll see what happens over the next week or two. And then those models say that after that, we should be out of the woods entirely sometime in the fall. So all the models are predicting that this pretty much goes away, and it will be an infection that people get from time to time. You know, we haven't even conquered measles, which is a vaccine preventable infection. We still get outbreaks, and that's going to happen in populations that maybe didn't get the vaccine or are immunocompromised. That's going to happen. But we're going to really see it go down into that level of, it's not like a death every day or even, you know, a death every week. We're going to see it go down into that background kind of infectious disease that we can prevent by being careful, but some people are going to get once in a while. And that's going to happen, most people say, somewhere around late August, September, October, the latest. So sometime in the fall. So in terms of the variants, all the information we have right now, it looks like very good protection against the variants that we have with the vaccines that we have. Eventually, especially those of us who have just gotten the vaccine and not gotten COVID, we may, you know, the people who have the best immunity are people who have gotten COVID in the past and also get a full series of vaccine. They have the strongest immunity, basically a kind of supercharged immunity. People who haven't gotten COVID, but who have gotten all the vaccine are the second most highest level of immunity. And actually people who have gotten COVID but didn't get the vaccine are the third. That's kind of the weakest level of immunity, other than people who haven't gotten it and also haven't gotten the vaccine. But for all the rest of us, for those of us who have gotten the vaccine but haven't gotten COVID, probably, you know, maybe in a year, maybe longer, we're probably going to need a booster. And the companies are already working on that as well. So we'll see.
Where are you off to, Doctor? You're in your car somewhere. Where you got a
Well,
Memorial
I'm
Day
getting
weekend
prepared.
getaway?
I'm going to a little group camping up at Santa Barbara Canyon. So I have some friends, we're meeting there, and we're gonna have some camping and hiking.
Great. Have a lovely Memorial Day weekend. Stay safe, and we'll see you next week.
All right. Good to see you, Mayor. We'll see you next week.
Thank you, Doctor. Take care. Bye-bye. Well, our regular Friday guest, Dr. Johnson, once again, giving us great advice on where we are with COVID and what we might expect, because this sounds like it's going to be with us for the future, like measles and other diseases that we can control but not completely eliminate yet. So wishing everybody to go get vaccinated. If you want to get vaccinated, there are vaccines available. You can go to the Christus St. Vincent site. You can go to the DOH site. There's a lot of ways to go get vaccinated at pharmacies. So please, let's continue to push our numbers up in terms of the vaccination rate. 74% one shot, 63% two shots in Santa Fe County. That's really good. We got to keep moving up the ladder till we get up to the 80-85%. That would be amazing. We would be in a position of great community leadership. If you have a concern, call a doctor, check with Dr. Johnson, look on the web, look at the Christus or the DOH or the La Familia website. There's lots of information about the vaccination, the locations, any potential effects that people have felt. As Dr. Johnson has said week after week, the effects are much less than the effects of getting COVID. So it's definitely worthwhile. And as she started out, if you feel like you might have some of the symptoms, you might have COVID, you might be experiencing the symptoms, be sure to get tested. And there is a COVID-19 hotline, 1-855-600-3453. So you could always reach out to get some help, information, and support. A couple thoughts about things that happened this last week and coming events. Wednesday night, we had a very robust city council meeting. The council discussed a big agenda all the way till around 11:15 at night, starting at 4 in the afternoon. But the real centerpiece of the agenda was a proposal worked out through our Public Works Department with a international consultant in the area of street lighting and the ability to implement new energy conscious and dark sky conscious street lights. We adopted a plan to update and improve our street lights. And I just thought I would let you know some of the benefits of this plan as approved unanimously by the City Council. This plan will save 2 million gallons of water per year. 2 million gallons of water per year because of this plan. We're going to reduce our electricity use by 9 million kilowatt hours per year. 9 million kilowatt hours per year. And we will not emit 7,000 metric tons of CO2 per year. 7,000 metric tons of CO2 will not go into the atmosphere because of this plan. We're going to pay for this plan by saving $1.3 million per year in taxpayer money because of these improvements. So it will pay for itself by saving $1.3 million every single year starting this year. Why is this important? Well, this is how Santa Fe leads in the fight against climate change. We have a sustainable Santa Fe plan. We want to reduce our carbon footprint. We want to be carbon neutral. We want to contribute to saving the planet. And this is a direct, immediate, real action that this city council, this administration advanced to make Santa Fe a leader in all areas of sustainability. Our track record in water conservation is second to none in the nation. We are converting our fleet, the city fleet, to electric vehicles. This project both transforms our streetlights and puts solar panels on every city building that is eligible for that, and makes a huge difference in terms of our contribution to fighting climate change. So when you ask yourself, climate change is an existential crisis. It is a global crisis, sometimes a crisis that seems bigger than any one of us or any one community can take on. This is an example of Santa Fe taking a stand right here, right now, with this project, cutting back on water use, electricity use, and the emission of CO2 every single year, and at the same time saving $1.3 million in taxpayer money to help pay for these amazing ecological and sustainable advances. We should give a big thank you to our Public Works Director, Regina Wheeler, and her team who came up with this plan. And we should also acknowledge the large number of people in our community who stepped up and spoke out to make it a better project. Now, this project was improved month after month with more input from our community, more advice, more counsel from across Santa Fe, people who cared about night skies, people who cared about public safety, people who were worried about our carbon footprint, people who want to make sure that we do the best possible job we can do to keep the skies dark and save money, save energy, reduce our carbon footprint, fight climate change right here, right now. Job well done. Memorial Day. Memorial Day is a city holiday. It's also a time for reflection of our servicemen and women, not just now, but over history. I have a deep recollection of visiting the American Cemetery at Normandy and realizing that the servicemen who stormed the beach that day to reclaim freedom for the world were willing to sacrifice their lives for us. And they did. And they are now memorialized and acknowledged, recognized, and celebrated for the ultimate sacrifice they made for us. Here in Santa Fe, the banners are up to see the men and women who served our country and who deserve our thanks as well. It's a day to reflect on freedom and on the sacrifices that freedom require, not only when it comes to service in the military, but as we've seen in this past year with COVID, in all kinds of service to our community, whether it's on the front lines of responding to COVID, being an essential worker who makes sure that we keep being able to access the essentials, the staples of daily life. We have a lot of people to be grateful to. And so let's take Memorial Day and the weekend to have family time, to enjoy Santa Fe and its glory as it resumes and comes back, returns to the beauty of our community. Let's also be grateful, have an attitude of gratitude for those who have sacrificed and continue to sacrifice so much for us. Remember this weekend going forward, as our shops and stores and merchants are open for business, please shop local. It's how we feed our own, take care of our own, support our own. Buy local, keep your money where your home is. Let's all help each other as we move forward. And finally, a word of congratulations to all the graduates. It is graduation across the state and here in Santa Fe, college graduation, high school graduation, as we were reminded on Wednesday night, graduation from kindergarten, graduation from elementary school. Our young people are graduating to the next phase of their lives, and we celebrate and salute them, their teachers, and their families. Well, that's about it for today. Thank you, everybody, for watching and listening. Please remember, COVID is still out there. We're getting, as Dr. Johnson said, 7, 10, sometimes 12 cases a day. So we're not completely immunized yet. Be careful, be safe, wear a mask. Remember, Santa Fe was one of the first, if not the first city in New Mexico to pass a mask ordinance. I think it saved lives. I think it kept us safe. It continues to keep us safe when it comes to things like dealing with pollen in the air or flu or colds or this other disease that Dr. Johnson mentioned that's making the rounds. Please wear a mask, use hand sanitizer, have some fun this weekend, get out, enjoy the beautiful weather, enjoy our beautiful city, take advantage of parks, trails, family time. Keep yourself safe, keep your family safe, keep the community safe. Together, we will continue to keep this city that we love, Santa Fe County, our community safe. I will see you next week after the Memorial Day holiday. Stay safe, enjoy the weekend. I'll see you next week. Take care, everybody.